Hey, got to come up with a different greeting every now and again. But I'm back at it. This is Ray from AEC and bringing you another medication for your hit list. And the medication today is magnesium sulfate. And a lot going on with this medication. This is one that's often poorly understood, rarely used when needed, when we take a look at collectively when maybe it could have possibly been used or when it should have been used. And sometimes it's intimidating for people when they look at the number of indications and they see the routes of administration. So this right here, this is a hit list med right here. This is something that you want to put on your to-do list and make sure you have your thinking cap on. So let's get to it. Mag sulfate is classified by a number of things, such as it is an electrolyte. It's an antidysrhythmic, it's an anticonvulsant, it's a CNS depressant, and a smooth muscle relaxant, which is going to lead into all the indications that we have listed for it because of the things that it performs. And so what does it perform? Mechanism of action. When it's being used as an antidysrhythmic in your body, it's going to act like a calcium channel blocker that's going to help to reduce impulses coming from the atria, SA node specifically, and it's going to prolong the time conduction takes as it goes to the myocardium, which means it's going to make it less able to beat faster in those times when we don't want it to. And but at the same time, if we give it at an incorrect time, it can make it go too slow and maybe drop the blood pressure a little too much. As an anticonvulsant, what's going to happen is the action on the striated muscles are going to essentially block transmission or reduce the acetylcholine anyways that's being released at the myoneural junctions. And all those words to say, it's going to help to slow all of those seizing muscles. The indications that we use it for are going to be pre-eclampsia and eclampsia. So pre-eclampsia being the hypertensive emergency that's going on with the pregnant female, but no seizure. And eclampsia is the same emergency, but the progression to the seizure. And typically in protocols, you have standing orders to use it for the eclampsia, and oftentimes it requires orders by the doc if you're going to give it for a pre-eclampsia. So know your local protocols as always. We can give it for torsades de pointes, which is a French word which means turning or twisting on the points. And I've heard some people refer to the rhythm as tornadoes because of the twisting type of fashion that the rhythm is in. We use it for refractory ventricular fibrillation or VFib, and what refractory means is that the treatment that we have given or our attempt to stop the action didn't work with the initial medication, and so now it's time to hit them with another one of these bad mamma jammas known as mag sulfate. And we have pulseless VTAC, especially in the presence of hypomagnesemia. Now, how the heck are you going to determine that if you ain't running labs in the street? Well, you got to remember that not every paramedic that goes out there is going straight to the streets. There are a lot of clinical providers that are operating in the hospital. There's critical care, ICU. There's all these different types of transport units. So we got our hands in a lot of pots, and it very well may be applicable for some of those. We have status asthmaticus. And if you didn't know, the status portion of asthmaticus is just letting you know the status of their asthma. And when it reaches that status asthmaticus, that means that they are also refractory to their treatment. And it's time to pull out another bad mamma jamma, mag sulfate. And so this is one of those like be all, save all types of medications because of all the things that it does. And we have a couple contraindications because it is a CNS depressant, and it relaxes smooth muscles, and it has the effect on muscles that it does. We've seen this term myasthenia gravis before, and this is something that causes progressive weakening of muscles throughout your entire body, and the respiratory muscle, the diaphragm, is the one we're worried about the most. And so if we're giving a medication that is coming from us, that is going to reduce muscular function already and potentially even reduce their condition beyond the point where it should be for them to function normally. And administration to these people can put them in a dire situation. And the other thing we're looking out for is impaired renal function. If they have impaired renal function, like they're on dialysis, probably don't want to use that medication that is going to make the situation for their kidneys worse. So you always want to be mindful of that. You know, your kidneys are going to do a lot of the moving of these products out of your body, and if they're unable to do so effectively, then that means they just collect and collect and collect, and that ain't good ain't nobody got time for that. The next thing we got is dosage, and so lots of little bullet points here. When we give it to eclamptic seizures, we can give up to 4 grams diluted in 50 mLs, and the 50 mLs just gives you a greater concentration of medication to fluid. But we want to make sure that we understand the dosing parameters, we understand the administration parameters. We mix it appropriately with saline, but preferably D5W. And we do it, you know, our pharmacology manual says 5 to 10 minutes. Experience and history would say at those times you probably want to keep it to about 10 minutes. It's pretty vasoactive with dilating the blood vessels. People get extremely hot, uncomfortable, burning sensations through their body, and then we just end up making them worse because of the stress and anxiety we put on them. So start low and work your way up if you're going to do something like that. But give the medication. Don't be afraid to do it. Next up, tornadoes or torsades with a pulse. And if they got a pulse, we're going to give them 2 grams that's diluted. Again, follow your protocols, but 50 mLs is what we recommend. D5W, and it's slow over 10 minutes. And this is something that's probably also done via infusion, volume over time infusion. Refractory VFib and torsades without a pulse. These are dead people that have shockable rhythms. And this is the dosing that we're going to use. 1 to 2 grams diluted in 50 mLs of D5W. This is going to be a true slow IV push. And we're going to leave it that way, and oftentimes not drip it in unless you're using pumps. But our pediatric abilities with this medication says that we can give 25 to 50 milligrams per kilogram. And you know, just make sure you're using the proper dilution and you're using the proper administration rate, you know, for some of the things that we talked about. Status asthmaticus is a condition in which we want to make sure that we are treating appropriately, because the status of the asthmaticus part is giving you a status labeling for their asthma. And in that case, they're saying, please treat me appropriately. I'm a little bit further along than maybe some people would suspect. You need a little bit bigger gun of a drug, such as mag sulfate, beyond albuterol and Atrovent and some of those other things that would proceed in the order of operations. But our dosing parameters is 1 to 2 grams in that 50 mLs that you've been seeing. This is preferably a 10-minute infusion, but just try to keep yourself from going too much less than that, and certainly 5 would be your absolute cutoff because of some of the side effects that it causes. And the takeaways, the clinical pearls, are torsades. If we're using it to treat, for example, refractory VFib, we're using it to treat refractory VTAC without a pulse, we typically don't have to increase the dosing but so far. But if we give it for torsades specifically, just be aware that it oftentimes takes greater than 5 grams, and your dosing parameters typically call for 4 as a max. Something to consider so that you didn't end up with an error in the way that you treated your patient. You know, if it's not part of your protocols, there may be an appropriate time for you to make contact with the hospital and provide them with a request for orders or whatever it is that you do in your agency. Because it relaxes smooth muscles, this is why we use it for asthma, and the problem is the constricted bronchioles. And the bronchioles are all smooth muscle. There isn't any cartilage. If the eclamptic seizures are refractory to MAG, then we need to be considerate of the benzo if your agency already didn't put the benzo first. So your Verseds, your Valiums, your Ativans. But that pretty much concludes magnesium sulfate. It's a lot. You know, don't be fooled by, you know, a couple bullet points on a piece of paper. That went a lot of directions very quickly. You know, and just like I always leave you with, please be careful out there. Do good things for your communities. And hopefully we'll see you all soon. Thank you for tuning in.